Take a moment to observe your ankle. Press 2 fingers into the skin just above it. When you lift them, notice if the mark remains for 30, 40, or even 60 seconds before slowly disappearing. This is not a natural part of aging, nor is it something normal after 60. Few people have ever explained what truly causes it. Often, the advice you receive focuses on salt intake or heart function. Sometimes a water pill is prescribed. You spend weeks running to the bathroom, yet the swelling persists. The doctor may call it managed, as if simply tolerating the problem is the goal. The real cause of this swelling has little to do with the heart or salt. It involves a silent system in the body that rarely gets discussed during a standard 15-minute appointment. By understanding it, you can gain a deeper insight into your own body and adopt a short evening routine that can improve how your legs appear by the next morning. Most people know about the heart and blood vessels. Arteries carry blood out, veins return it, and the heart pumps continuously. But there is a second network in the body, flowing throughout every cell. This system carries cellular waste, excess proteins, debris, and importantly, extra fluid. This is the lymphatic system. Unlike the heart, the lymphatic system has no pump. Blood circulates automatically, but lymph moves only through muscle contraction. Each step, ankle flex, or rise from a chair, helps push fluid upward toward the neck, where it re-enters the bloodstream. If movement stops, lymph flow stops. Fluid then accumulates in the lower legs, much like water collecting at the bottom of a bowl. After 60, 3 changes make this worse. First, lymph vessels stiffen, losing the flexibility they had in youth. Second, the one-way valves inside these vessels start failing, allowing fluid to slide backward. Third, connective tissue in the lower legs loosens, letting fluid settle in the tissue instead of being efficiently drained. Together, fluid leaks faster, drains slower, and has nowhere solid to go. It is important to recognize warning signs. Sudden swelling in one leg with warmth or pain may indicate a deep vein clot and requires urgent medical attention. Both legs swelling with shortness of breath, difficulty sleeping, or inability to climb stairs signals a heart problem. Rapid swelling with foamy urine and unexplained weight gain points to kidney issues. If these conditions occur, medical evaluation is necessary immediately. For gradual swelling over months or years, equal in both legs, worse in the evening, and not causing rest-breathing issues, the most likely cause is a lymphatic drainage deficit, which can respond well to the right approach. There are 3 main patterns of ankle swelling. Venous swelling occurs when veins struggle to return blood, often accompanied by visible twisted veins, brownish skin near the ankle, and worsening swelling after long periods of standing. Lymphatic swelling, the most common in people over 60 without heart or kidney disease, is soft, puffy, and leaves an indentation when pressed. This form of swelling frequently extends across the top of the foot. A soft, raised area often appears just behind the point where the toes connect to the foot. One feature stands out above the rest. In long-standing cases, the skin covering the top of the foot becomes noticeably thicker, with a texture that can resemble leather. When you attempt to pinch it, the skin barely lifts. It seems attached to the underlying tissue as though fixed in place. For an experienced clinician, that single observation can reveal a great deal. The third pattern involves either the heart or the kidneys. In these situations, the heart is no longer circulating blood efficiently enough, or the kidneys are failing to filter properly. Swelling appears in both legs, but it rarely occurs by itself. Other signs usually accompany it. Fatigue becomes more pronounced and begins limiting daily activities. Nighttime trips to the bathroom become frequent and disruptive. Weight increases rapidly despite no major dietary changes. Breathlessness develops during activities that previously caused no difficulty. When these symptoms are present, a proper medical evaluation is required. Many individuals over 60 experience gradual swelling that affects both legs equally, becomes worse in the evening, and occurs without heart-related symptoms. These people often fit the second pattern. The encouraging reality is that the lymphatic system responds remarkably well to specific physical stimulation. It does not necessarily require another medication. It often simply needs assistance returning to its normal function. Consider someone named Margaret. Margaret was 71 years old. She spent 35 years working as an accountant. Organized, precise, and dependable, she rarely missed an appointment. She had been coping with ankle swelling for approximately 3 years before seeking help. The swelling affected both legs equally. It intensified by evening and largely disappeared by morning. The presentation was classic. Before she was evaluated, she had already completed cardiac testing. An echocardiogram showed normal findings. Her ejection fraction measured 58%, comfortably within the expected range. Kidney testing was also normal. She had taken a diuretic for 14 months and had dramatically reduced salt intake. She followed every recommendation she received. Yet every evening at 8 p.m., removing her rings remained difficult. Margaret eventually mentioned something that had never come up during previous appointments. During a week-long visit from her grandchildren the previous summer, she spent nearly every day moving. She chased a 3-year-old, walked to the park, and repeatedly climbed stairs. During that period, her ankle swelling improved more than it had in years. 4 days after the grandchildren left and she returned to her usual routine, the swelling returned. That detail mattered. Improvement during sustained movement and worsening during prolonged sitting is a hallmark sign of lymphatic involvement. This is not an argument against diuretics. In the correct circumstances, they are entirely appropriate. However, when swelling originates from lymphatic dysfunction, the mechanism is different. Margaret did not need another prescription adjustment. She needed a way to reactivate a system that aging and inactivity had gradually allowed to become less effective. What makes Margaret's experience relevant to many people is that she was not truly inactive. She walked to her mailbox. She prepared meals. She moved around during the day. Yet she routinely spent 4 to 6 uninterrupted hours sitting every day. Those long periods created ideal conditions for lymphatic backup. The lymphatic system is not primarily concerned with total daily step counts. What matters is how frequently the calf muscles contract throughout the day. Those contractions keep fluid moving. 4 hours without movement means 4 hours of accumulation, even if a 20-minute walk happened earlier in the day. Several factors actively worsen lymphatic drainage in this age group. The first is sodium. Most people focus on the salt shaker, but that is often not the primary source. Excess sodium frequently comes from bread, cottage cheese, canned vegetables, deli meats, seasoning packets, and restaurant soups. Sodium draws water from the bloodstream into surrounding tissues through a highly precise chemical process. Research suggests the body may retain substantial fluid in response. Some estimates indicate several cups of water can be held for every gram of excess sodium consumed. A person may believe salt intake has been reduced simply because table salt is no longer used. Yet 2 servings of canned soup each week can still provide a surprisingly large sodium load. The second factor is evening sitting. The period between roughly 7 p.m. and 10 p.m. is often when people finally relax after the day's responsibilities. Unfortunately, these same hours are frequently when the legs need movement the most and receive the least. 3 hours of inactivity during the evening allows fluid to continue collecting in tissues. That accumulated fluid must later be reabsorbed overnight, potentially interfering with sleep. The third factor is alcohol. For some people, this topic can be difficult to hear. Nevertheless, research indicates that even moderate alcohol intake can influence how fluid is redistributed overnight. Alcohol widens small capillaries, increasing the amount of fluid that escapes from blood vessels into surrounding tissues. It also suppresses the hormone responsible for signaling the kidneys to reduce nighttime urine production. The result is a greater volume of fluid entering the legs and more nighttime bathroom visits as the body attempts to manage the excess while sleep is taking place. Eliminating alcohol is not necessarily required. However, for individuals with significant swelling, the evidence is strong enough to make this information worth understanding. Before discussing specific techniques, it helps to understand what supports lymphatic function internally. Water is one of the most important factors. At first glance, this seems counterintuitive. If the legs already contain excess fluid, drinking less might appear logical. In reality, dehydration causes lymph fluid to become thicker and slower moving. Adequately hydrated lymph remains thinner, flows more freely, and drains more effectively. A common target is approximately half of body weight in fluid ounces distributed throughout the day. Intake should gradually decrease after late afternoon to reduce overnight bladder disruption. Foods rich in flavonoids can also help. These compounds are found in dark berries, red and purple grapes, citrus pith, and red cabbage. Flavonoids help reinforce capillary walls and reduce the amount of fluid that escapes into surrounding tissue. When less fluid leaks out, the lymphatic system has less work to perform. Even a daily cup of mixed dark berries represents a simple adjustment rather than a major dietary overhaul. A daily serving of mixed dark berries may seem modest, yet over 6 to 8 weeks, it can produce measurable improvements in capillary strength. Another important factor is protein, especially albumin. Albumin is a protein circulating in the bloodstream. Its role is to keep fluid inside blood vessels through osmotic pressure. When albumin levels fall, something commonly seen in adults older than 65 who consume too little protein, water escapes from the vessels more easily because the force drawing it back is reduced. 2 servings of quality protein each day can help. Eggs, fish, legumes, and Greek yogurt are examples. Among the available approaches for long-term lower leg swelling, this remains one of the simplest and least utilized. Now comes the central routine. Everything discussed so far leads to this sequence. The order matters. The timing matters as well. Begin in the morning immediately after waking. Before your feet touch the floor, while still lying in bed, perform 30 ankle pumps. Point the toes away from your body, then pull them back firmly toward your face. Complete 30 full repetitions. This activates the lymphatic system before gravity starts drawing fluid downward. The exercise requires less than 1 minute and helps establish drainage for the rest of the day. Next comes the hourly reset. Whenever you remain seated, use a timer if necessary and set it for 50 minutes. When the alert sounds, stand and perform 20 heel raises. Lift onto the balls of your feet, pause briefly, then lower yourself. If standing is difficult, remain seated and move the toes upward and downward 20 times while keeping the heels on the floor. This prevents a full hour of stagnation and keeps fluid movement active. The exercise takes roughly 30 seconds, yet the accumulated benefit throughout an entire day can be substantial. The third step is a walk before dinner. 5 minutes before the evening meal, take a 5-minute walk. It can be around the house, around the block, or anywhere convenient. Walking engages the deep muscles of the calf in a way seated movements cannot fully duplicate. It serves as the final full-body pumping opportunity before the evening relaxation period begins. Completing it before dinner also makes it less likely to be skipped. The fourth step is the evening drainage sequence. Perform it 90 minutes before bed. This is the centerpiece of the protocol. Choose a location near a wall, or position yourself near the headboard of your bed. Raise your legs so the heels sit higher than the hips, and the hips remain higher than the heart. A perfect 90-degree angle is unnecessary. The objective is simply to reverse the direction of gravity's influence and allow fluid to move upward rather than downward. Remain in this position for 15 minutes. During the first 5 minutes, make slow ankle circles. Complete 10 rotations clockwise and 10 counterclockwise with each foot. Move through the full range of motion. This action compresses lymphatic vessels around the ankle and begins drainage from the furthest point upward. During minutes 5 through 10, alternate slow ankle flexes. Point and flex 1 foot at a time at a controlled pace. Each movement activates the calf muscles. Think of every flex as another compression of the body's natural pump. During minutes 10 through 15, practice deep diaphragmatic breathing. Place one hand on the abdomen. Inhale slowly through the nose while allowing the belly to rise for a count of 4. Hold the breath for 2 counts. Exhale gently through the mouth for 6 counts. As the diaphragm lowers during inhalation, it physically compresses the thoracic duct, the primary lymphatic channel running through the chest behind the breastbone. Deep abdominal breathing is one of the most effective ways to stimulate lymph movement, yet few people recognize its importance. After 15 minutes, roll onto your side and sit up gradually. Then complete the final portion. Starting near the ankle, place the flat surfaces of your fingers against the skin. Do not use fingertips alone. Glide upward toward the knee using gentle but steady pressure. Always move toward the heart. Never move downward. Perform 10 long strokes on each leg. This simplified version of manual lymphatic drainage helps guide fluid from saturated tissues into lymphatic capillaries, where it can continue moving upward. The process is uncomplicated. It requires approximately 2 minutes. Many people notice an urge to urinate within 30 minutes afterward. That fluid is being cleared on your schedule rather than accumulating until the middle of the night. There are also 2 self-assessments that can be performed immediately. The first is the pit test. Locate the front edge of the shin bone approximately 4 inches above the ankle. Press firmly with the thumb and maintain pressure for 15 seconds. Release and observe. If an indentation remains visible and requires more than 10 seconds to disappear, pitting edema is present. A mild result leaves a small depression that resolves within 30 seconds. A moderate result creates a deeper mark lasting 1 minute or longer. A significant result leaves an indentation that remains for several minutes. Record the result today. Repeat the assessment after 2 weeks of following the protocol. The difference can be measured. The second assessment is the stemmer sign. Attempt to pinch the skin on the top of the foot just behind the second toe using the thumb and index finger. If the skin lifts easily into a small fold, lymph movement is functioning reasonably well. If the tissue feels fixed, flat, and difficult to lift, the stemmer sign is positive. This is considered one of the most dependable clinical indicators of chronic lymphatic congestion. It suggests the tissue has remained overloaded long enough for structural changes to begin. Consistent adherence to the protocol over several weeks is often necessary before the full benefit becomes apparent. For tonight, focus on 5 actions. Perform the pit test and record the result. Identify the hidden sodium source you consume most frequently and replace it. Take a 5-minute walk before dinner. 90 minutes before bed, elevate the legs for 15 minutes, and finish with 10 upward strokes on each calf. Tomorrow morning, complete 30 ankle pumps before your feet touch the floor. Continue these habits for 14 days. Then repeat the assessment. Your ankles are not necessarily showing signs of poor aging. More often, they reflect a drainage network that has stopped receiving the signals needed to operate efficiently. Provide those signals consistently and at the proper times each day. The results are often easy to notice. They appear in the mirror. They become evident when putting on shoes. They can even be felt during the first morning when uninterrupted sleep replaces repeated nighttime awakenings. If this information was valuable, share it with someone who may benefit from understanding why swelling develops and what practical steps may help support healthy drainage. Follow for more clear, research-based health discussions and future educational content. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.